This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
Governor Tony Evers.
Good afternoon, everyone. Thanks for joining us again today. So far, since the first vaccines arrived in our state just over 2 months ago, more than 1 million vaccine doses have been administered statewide. That includes more than 45% of our folks over the age of 65 who have received at least one dose of the vaccine. And we know we can only expand and grow our vaccine program from here. That's why I was glad on Friday to sign a bipartisan bill allowing pharmacy technicians and students to administer the COVID-19 vaccine. This ensures individuals who are capable and who have the training and experience to administer vaccines are able to do so, helping expand our vaccine workforce and get shots safely and efficiently into arms. Because folks, it's all hands on deck. Just as they always do, Wisconsinites are stepping up, helping out and doing their part to get our state back to some sort of normal. Just take a look at the good work done on our UW campuses. Over the past week, I've had the pleasure to visit and tour 2 new community vaccination clinics at our UW campuses in Marinette and Oshkosh. This is the Wisconsin idea in action, bringing partners together to tackle the challenges our state faces and to bring solutions into the heart of Wisconsin communities. I'm grateful to our healthcare partners, including Prevea Health and Advocate Aurora, for working with our UW system to get this done. And today we announced 4 more community-based vaccination sites, which will be opening in the coming weeks. As you know, earlier this month, our first community-based site opened at Black Hawk Technical College. We said then that our goal was to continue to expand the community sites as more vaccine became available and as we move further along in our vaccination program. These 4 new sites will work in tandem with current vaccinators across the state and will be located in La Crosse County, Racine County, Marathon County, with the last clinic split between Douglas and Barron counties. They will open within the next two months, and we will have more on these sites in the coming weeks. But as our next eligibility groups are opening up on March 1st, these sites will be critical to helping get the vaccine to every eligible Wisconsinite who wants it. because as I've said before, we're all safer and closer to statewide recovery when shots get into the arms of our Wisconsinites. As of yesterday, Wisconsin was fourth in the nation for the percentage of our vaccine supply used, and we will continue to get shots in arms as soon as they are available. But as I said before, it is all hands on deck. While we're making great progress with our vaccine distribution across the state, we know our fight against this virus isn't over. In fact, it has been made even more crucial as we face new variants of the virus and a state that is not fully vaccinated. Folks, even if you have received one dose or completed your vaccine series, we need your help to keep your friends and neighbors who haven't been vaccinated yet safe and healthy. I know it's been cold. We've had some classic Wisconsin winter weather, and we're all tired of shoveling and being cooped up, but please continue to stay safer at home. Get your fish fry to go, check in and catch up with the family and friends virtually, and continue to avoid large gatherings of people. And always, always wear your mask. Together, we can stop the spread of the virus, get our state vaccinated, and bounce back stronger and better. Finally, today, Wisconsin joined the nation in lowering the flags to half-staff in honor of the more than 500,000 people nationwide, including more than 6,300 of our fellow Wisconsinites, were killed this year by this virus this past year, leaving behind spouses, kids and grandkids, co-workers, best friends, and so many who love them. Many Wisconsinites know firsthand the pain of this loss, and we join them in their mourning with heavy hearts. As we reflect on the lives of Wisconsinites who are no longer with us, it's almost unfathomable the immeasurable loss we have experienced this year. But it's real, and it's going to take all of us leaning on and counting on one another to get through it. It's going to take the hope and empathy we find in one another to get through it. So once again, on behalf of the state of Wisconsin and Kathy and myself, we share our deepest condolences with all the families who are mourning the death of a loved one. Our hearts are with you. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dijk. And it's all yours, Julie.
Thank you, Governor. And thank you for those words and for the action of lowering the flag in honor of those who have lost their lives. Well, good afternoon, and thank you for joining us. As of today, we've administered 1,208,153 doses of COVID-19 vaccine in Wisconsin, and 370,578 of those were second doses, which means those 370,578 individuals have completed their series and are protected against COVID-19. In less than a week, that number rose over 100,000. We are one of the top states in the nation for vaccine administration, and nearly 47% of Wisconsin residents age 65 or older have received at least their first dose of the vaccine. We are committed to getting vaccine in arms quickly, safely, and equitably, and we are making significant progress on that goal. In fact, Wisconsin is among the top states in the country for vaccine administration, and we still need your patience and perseverance as we continue to ramp up vaccinations across the state. And we have some good news to share about our efforts. Our allotment is increasing. This week, we will have 115,000 first doses to distribute to vaccinators, which is a 64% increase from mid-January. We also know that we'll have that same amount, 115,000 doses, for at least the next 2 weeks. Of course, even this increased amount is not enough to fill all the requests our vaccinators are making. We had over 500 vaccine providers request 350,000 doses last week. So we will continue to advocate for more allotment from the federal government. In addition to those 115,000 doses coming directly to the state, Walgreens locations across the state will receive 35,350 doses of vaccine this week, which is double the amount they received the week before. And today, as Governor Evers said, we are announcing the location of 4 more community-based vaccination clinics that will open over the next 2 months. These clinics will build on the success of the Rock County site that was launched last week. Community-based clinics are only possible through collaboration with local health departments, the UW system, vaccinators, AMI Expeditionary Healthcare, the Wisconsin National Guard, Wisconsin Emergency Management, and DHS. These partners are all coming together to ensure Wisconsin residents have access to COVID-19 vaccine. We are grateful to them for their hard work, and we look forward to our continued partnership as we get these clinics up and running. We will continue to expand our vaccination effort, and as we do that, we also need to remember that COVID-19 is still present and spreading in our state. The vaccine is an important tool to stop the spread, and please get vaccinated when you are eligible, and continue to do what we know works to stop the spread. As the governor said, stay home, limit your interactions to the people you live with, wear a mask, stay 6 feet apart, and wash your hands frequently. We are adding 566 new cases today, which brings our total confirmed cases of COVID-19 to 560,564 people. Our 7-day average of cases is 604. Today, we are reporting 33 more Wisconsinites who have died from COVID-19, which brings our total deaths to 6,317 people. Our thoughts continue to be with the families and friends who have lost loved ones to this virus, and we must continue to do all we can to stop the spread. Thank you, and we'll turn it back to Jennifer for your questions.
Thank you. And a reminder to maintain audio quality. Please keep phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. And in the interest of time, please 1 question per reporter. And we'll begin this afternoon with Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for taking my question. I know that this has been asked before on several previous occasions, but it hasn't been recently. Given the current downward trajectory of the COVID-19 numbers in the state, combined with the increase in vaccine numbers across the state, at what point do you see us kind of being able to get out of the pandemic scenario, Governor Evers? At what point do you think that the mask mandate may be allowed to expire naturally instead of be extended? Around what time do you think we may be seeing, us getting out of this? Thank you.
Well, it's interesting to bring that up because I've seen President Biden ask the same question several times, and it's an impossible question to answer. I mean, right now, if we, as a state, received a massive increase in vaccinations, that number would be probably, or that date will be probably sometime this summer. That's not going to happen. And so, and in addition, in order for us to continue to be in this downward trajectory, we do need to make sure that people mask up when they're outside of their homes and stay safe. It's just basic mitigation prevention that we have to continue to do. So a lot of it has to do with the number of vaccines that we have available. And so because we don't know that, we know there's some stability, and we know that it is increasing gradually, and that is working to our advantage. But to be able to sit here at this point in time and say at such and such a date or within these 2 weeks, I think it's impossible to make that judgment. I know the president was talking about things returning to normal sometime around Christmas, and I'd say that's out there, but it is going to take time. I mean, we just have recognized that half a million people, or 500,000 people in the country, have died from COVID-19, which surpasses all sorts of people dying in different world wars and other conflicts. And patience is really important. Obviously, we will continue to be more available to go outside and do the things that we want to do outside. And I anticipate our parks will be used a lot this summer, but we still have to be careful. This is a serious disease that has caused the death of over just about 6,500 of our friends and neighbors, and so we can't afford to let up.
Thank you, Rob. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. Thanks for taking my question. So my question is in regards to just kind of an update on the March 1st date that's approaching and hopefully beginning to vaccinate phase 1B. First, are we still good to go with that? Do you see it starting on time? And also, how will you be verifying or how will clinics be verifying the people that are coming in to get this vaccine? Obviously, with 65 and older, you know the age. Now it's going to be based off occupation. So what is the plan or what are you recommending to these vaccine clinics? Thank you.
Well, we are definitely moving forward with March 1st. As I just mentioned, we're nearly 47% of people age 65 plus have received their first dose. And so as we predicted when we established this phase, our goal was to be at 50% by March 1st. And I think we will get there. I think we'll be a little bit beyond that. So I want to first of all emphasize that people age 65 plus who are in the second 50% are still going to get your vaccines. We feel confident with moving forward with March 1st because we are receiving more vaccine. And so there is vaccine for those of you who are 65 plus who have not yet received your vaccine. We'll continue to supply vaccine for this population and then use the increased doses to begin to serve the phase 1B population. As noted when we announced this group back in January, the top of the priority of the additional eligible groups are our educators and childcare providers. And so we are working with our local and tribal health departments to ascertain their plans for vaccinating this group and begin staging out vaccine to different school districts and counties across the state over the month of March and into April to get that group vaccinated first. As we begin to finish the age 65 plus group, there'll be more room in the vaccine system for other essential workers in that group. And we're recommending that people may want to check a name badge or a pay stub to ascertain if they work in one of those industries, or to have people sign an attestation form saying, you know, I verify that I am part of one of those industries. But we are relying on the goodwill of Wisconsin people to be honest. And I think the important thing to remember is a shot in an arm is another person protected in this state. And we will all get our turn, and we will all get vaccinated. As the governor said, likely sometime later this spring or summer, everyone will have availability. And so thank you for your patience, Wisconsin, and we will get there.
Thank you, Katrina. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. Can you give an update on where things are with the long-term care vaccination program? Are we almost through the nursing home's second visit? Thank you.
Yes, I think we're nearly complete with the nursing home second visits. We've had a few weather-related events, both our own staff traveling and then delivery of vaccine late last week into this week. So there may be a few who are still finishing this week. And just as a reminder, each skilled nursing facility will receive 3 visits. The majority of the shots are being done at those first 2 visits. But at the second visit, we've also had the opportunity to vaccinate residents and staff who didn't have a chance at the first visit. Either they were absent or not part of the nursing home yet, or weren't sure they wanted a vaccine and have changed their mind. So there will be a third visit about a month from now to finish up those last few folks there. Similarly, with the assisted living and other long-term care facility programs, we were about 88% done by the end of last week. Again, had hoped to be 100%, but the weather and vaccine delivery got in the way of that last 12%. Those are finishing this week. And we've already started on second doses for a number of those assisted living and other long-term care centers as well, too. And so those will be finishing up over the next 3 weeks or so.
Thank you, Sean. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thank you for holding this call, as always. I'd like to ask if you can tell us of the new facilities, community clinics that you're announcing, can you tell us where within those specific counties the facilities will be, specifically the Racine County facility, and why did you pick those particular counties? Thanks so much.
Sure. We did an extensive process of looking at a number of different factors in the state, both where were population centers that we'd have a large enough population to get high throughput through those clinics, who was willing to host regional centers, relationships with healthcare providers and local and tribal health departments in both the host community and surrounding communities, and the presence of vaccine coverage at the time we were making the decisions, and also representing geographic diversity across the state. So all of those factors factored into where we cited and selected the sites. Final decisions are still being made about the exact locations, and so announcements about those will be coming in the coming weeks.
Thank you, Rose. Now to David Wahlberg from the Wisconsin State Journal. David?
Yes, thank you. Can you clarify how you're prioritizing teachers within the new groups to be added to 1B? Does that mean other groups, other essential workers, for example, will need to wait until teachers are partly the way through? And also in Dane County, they've asked for more doses to give to teachers starting next week. Will they get them?
So we, both the State Disaster Medical Advisory Committee and DHS, as we approved their recommendations, said that we wanted to get our educators vaccinated as quickly as possible, and so therefore they were put first in line in this group. And that was largely because this is a group that is essential. We want our kids in school. We know a number of school districts have been in person since early in the year, and we know a number of additional school districts are moving in that direction. And we know teachers work every day with a population that is not able to be vaccinated because of their age. So vaccination is one part of creating safety in schools. It is not the only thing that is necessary. As the CDC has just outlined, schools can be very safe using other mitigation strategies like masking for everyone faithfully, keeping physical distancing, good hand hygiene and respiratory etiquette, and good environmental controls and isolation and quarantine for people who are ill. So it's a layering over those important mitigation strategies, but an important one that we want to protect that workforce. So what it means for others is they will not be first in line. Everyone in the group cannot get their, this is a group of nearly somewhere between 800,000 and 1 million people, and we don't have enough vaccine for everybody to be in line the first week of March. So teachers and educators and childcare workers will be front in line, and as I said, as people who are age 65 start to complete their vaccine series, that will create more space in communities across the state for those other essential workers like utility workers and transit workers and workers in our food service industry, food protection industry, to also queue up in line to get vaccine. Public Health Madison, Dane County has asked for a vaccine. They'll receive some. Nobody's getting all the vaccine they've asked for. And we are working with our local health departments to help us understand who they're vaccinating, who in the community is vaccinating them, and what kind of pacing and scheduling they'd like to do in their community. And our commitment to them is, as our local health departments provide that information to us, we'll make a master plan over the next 6 weeks so everybody will know when they're getting vaccine for their community and their school districts.
Thank you, David. Now to Brittany Schmidt from WBAY-TV in Green Bay. Brittany?
Hi, I have a question just going back to, so we're allowing, you said 800,000 to 1 million people of this next group. I took a phone call from a gentleman this weekend who was very concerned about kind of, quote unquote, competing for these vaccines. He's 75. He says he hasn't been able to get in anywhere yet. And his worry is, how do I get in before these other people are allowed to also now get a vaccine? Any word of advice for him?
So what I would say to that gentleman is we're keeping the same supply of vaccine going to our vaccinators targeted to people age 65 and our other first groups, our unaffiliated healthcare workers, frontline healthcare workers, and police and fire. Most of those folks have been vaccinated. There's a few left that are finishing up, but we are keeping a steady supply of vaccine for those groups. We've gotten about halfway over the last month, and so what we anticipate is we'll get the other half of the way using that vaccine supply over the next month. The other thing is what we've heard from the White House and the CDC is that we're not going to see vaccine supply go down. As we've said, we've gone from about 70,000 doses a week in mid-January to 115,000 doses a week here at the end of February. We've gone from 0 doses going to Walgreens to nearly 36,000 doses going to Walgreens. These are significant increases in vaccine that are coming into our state in the last week or so. And so there is more vaccine coming. We also know that at the end of the month, which is Friday, the Johnson & Johnson vaccine will be reviewed by the Food and Drug Administration, and we're really hopeful we'll have a third vaccine to add to the mix, which will also increase our vaccine supply. So I understand if you're in the half of the folks 65 and older who have not yet received your vaccine, that you may be anxious about whether you're ever going to get one, and what I can assure you is you will. There is more vaccine coming. You will not be crowded out, and we will get that vaccine in your arm. The last thing I'll say about this is we're adding a new map to our website later this week, and that'll be a place where you can also find out who in your community is getting vaccine. That will help you know where you might want to call or check on their website. So many more tools to help people find those vaccines and get them in their arms.
Thank you, Brittany. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hello, thank you for doing this call and for taking my question. At the end of the week last week, it was reported that the number of positive tests was spiking among UW students. That contact tracing had found people in the university community were attending gatherings, often without masks. So how concerned are folks about the possibility of a repeat of the surge that began on college campuses last fall? And what actions is DHS taking in response, either on your own or in collaboration with local health authorities or the UW, to head off that kind of possibility in the light of these newest data that's out there? Thank you.
Well, I know we have Dr. Westergaard on the phone. Dr. Westergaard, would you like to begin a response to that question?
Sure. So from the perspective of us in the Division of Public Health at the State Bureau of Communicable Diseases, we're supporting both the campus and the local jurisdiction, which in this case is Public Health Madison-Dane County, on doing running the drill that we've always run, which is finding cases, doing interviews, contact tracing, and trying to stop chains of transmission from continuing such that outbreaks get larger. I would say we've gotten quite a bit better at doing that. We've also have better turnaround time with our tests, and the barriers to getting tests are all lower. So that an additional thing we have in our favor, I think, is just sort of general awareness and understanding of our communities, and we have a certain level of protection from prior infection. So there's a number of things that make us feel like we are the risk of a large and dangerous surge is less than it was in September, but we are not out of the woods. We are not protected from having ongoing spread in the community. So we need to continue to do all the things that we know prevent infection, but I think the tools that we've had, the knowledge that we've gained, and the infrastructure puts us in a good position to identify clusters and stop additional chains of transmission. So it's impossible to predict the size and scope of new outbreaks as we go forward. The risk is going to continue to be there. And we know that the risk of new variants might even be higher because they're more highly transmissible. But despite those threats, I think we feel good about the things that we've learned and the resources we've put in place that we can get on top of this. But it requires that we not let up and we continue to use all of the strategies that we've learned to use.
Thank you, Eric. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline? Madeline Anderson from Fox 6.
Hi, sorry about that. I am wondering why Milwaukee County is not among the locations chosen for the state's community-based vaccination clinics when the county is one of the lowest percentages of the population vaccinated compared to other states, as well as the largest concentration of African Americans in the state. And as the state data shows, only about 4% of Black Wisconsinites have received the vaccine compared to about 13% of white residents. Thank you.
Those are all good factors why we should be looking at Milwaukee County for a higher throughput site. And we are working with officials with both Milwaukee County and the city of Milwaukee to explore a FEMA site in Milwaukee. So there's a number of different mechanisms for how we can provide community-based vaccinations. And so we are in planning conversations with FEMA to look at a site in Milwaukee and to determine what the best location for that site will be. And one of the big advantages for the Milwaukee area of that site would be not only additional resources coming into the community, but then the resources that Milwaukee has been using to provide vaccinations at the Wisconsin Center can be redeployed throughout the city. As you mentioned, to move into neighborhoods where vaccination may be lower, particularly neighborhoods of people of color, as you've noted the disparities we see there, and offer vaccines locally, right in the neighborhood, or easy to locate locations for residents of Milwaukee County. We were hopeful in the beginning that FEMA was coming with vaccine. It appears that is not the case, and so we need to factor this into the state allocation. And again, we're working very closely with the city and county to do that and hopefully have a FEMA site up and running within the next few weeks.
Thank you, Madeline. Now to Jennifer Cleasy from WKOW-TV in Madison. Jennifer?
Hi, thank you. I'm wondering if our state has seen anything like some of the other states have seen, where people are traveling to get appointments that are targeted to specific communities. They're traveling to those communities from somewhere else. Has that been seen in Rock County, or people trying to do this? And are there plans to balance access issues like online appointments favoring people who have good internet access, or healthcare systems favoring people who have doctors?
So we know we have vaccinated people from other states, and I think, as you note, this could be a bigger issue in border communities. What we've said to our vaccinators is the priority goes to people who live work, or study in Wisconsin. And so we also know there's a number of people who live right across the border who drive into our state every day and spend all day here working or going to school. And so, we want to be sure and vaccinate those folks who are amongst us as well. But let's also remember that COVID-19 doesn't know where the state border is. And so this is a local, a state, a national, and an international vaccination campaign. We have got, if we get to 80% in Wisconsin and Illinois is only at 50%, that's not going to protect us well. So I really want our vaccinators thinking about how we can get everybody protected, yet we also want Wisconsinites to get the majority of our vaccines because it's allocated based on a population level, and that's how the federal government is trying to distribute the vaccine in a fair and equitable manner.
Thank you, Jennifer. Now to Stephanie Huff from WisPolitics. Stephanie.
Hi, thanks for taking my call this afternoon. I'm wondering if Rock County, the vaccination site, is still at 200 doses per day, and I'm wondering if the other 4 sites will also start out at 200 doses per day or another figure. Thank you.
Yep, they still are because we don't have more vaccine. If we had more vaccine, they could certainly be doing more vaccinations a day, and that is the level we're anticipating starting the other sites. Again, we're hopeful. We're hearing news that Pfizer and Moderna may be increasing their production, and we'll see more vaccines from those manufacturers. Again, perhaps a third manufacturer coming on very soon, and we know there are 2 more in the pipeline. So all of these sites are capable of doing many more vaccines a day, and so we are in a position we would be able to scale them up to vaccinate more people once we have those vaccine doses in hand. But at this point in time, they're all starting at about that 200 doses per day.
Thank you, Stephanie. Now to Nick Willems from Milwaukee Business Journal. Nick.
Hi, my question is if herd immunity has come to Wisconsin, or if you think, or how long you think it will take for that to happen, or in just certain regions around the state. Thanks.
Yep, we're not quite near herd immunity anywhere in the state yet. We're at about 14% of the state that has received the first dose, a little over 6% that have received both doses, and that would really be how we would measure herd immunity. And we need to get somewhere, Dr. Fauci says, between 70 and 90% to achieve herd immunity throughout our state. So we've made a lot of progress. We were at 0% on December 14th when we started. This is good progress, but as you can tell, this is, as we've said, a Herculean effort. We've given a little over 1 million doses to get to 80% of adults at herd immunity. We need 7.4 million doses administered. So only another 6.2 million to go, and we'll be there.
Thank you, Nick. Now to Seneca Bargua from NBC 15 in Madison. Seneca. NBC 15? Okay, we're moving on then to Brittany Slaughter from WAOW-TV in Wausau. Brittany.
Hi, thank you. Yeah, so you touched on this a little bit with the teachers in, schools. Down here in Wausau, a lot of schools are going back to, 4 or 5 days a week. I know that it is pretty much up to the school boards, but is this something that is safe to do? And what are the risks of students going from being home most of the week to going back to the classroom? Thank you.
Well, I want to go back to the recent guidance that CDC has released and what it says, and it's based on a number of different studies about schools that have been educating with face-to-face education over the last few months, both in the United States and around the world. And what CDC found is when people in schools use really good mitigation strategies, that spread of disease in schools is particularly low. It's especially low from student to student. Most student-to-student spread actually happens outside of school, either in extracurricular activities or at social events outside of school. And for those reasons, as you might anticipate, it is higher in older students, more middle school and high school students than younger students. There's also very little spread from students to teachers. Very little spread. Most of the spread that happens in school is staff to staff. And there are ways to reduce that as well, too. For example, closing the staff lounge is one strategy that many school districts have deployed that has seen significant reductions in that kind of staff-to-staff spread, because sitting in a small room together with your mask off, eating lunch, is a perfect way to spread COVID. So schools can be safe as long as you're using those 5 strategies I mentioned earlier: masks, physical distancing, good hand hygiene and respiratory etiquette, like coughing into your elbow or a tissue, good environmental cleaning and ventilation, and then making sure when someone is ill with COVID-19 that if they have symptoms, they're tested right away, removed from the school environment. If they turn to be positive, that they stay isolated, and any close contacts are quarantined.
Thank you, Brittany. Now to Christina Leffring from Up North News. Christina?
Hello, this is Julian Emerson. I'm actually subbing in for Christina, and I had 2 questions, and they have both been answered, so you guys can move on.
Okay, thank you. Now to Chuck Kornbach from Milwaukee Public Radio. Chuck.
Good afternoon. What update can you provide, please, on the registry that you announced last week? Some of the locals that have been testing it, I guess, are reporting mild glitches. What sort of improvements have been made, and are you still on track with the registry, please?
Thank you, Chuck. Yes, we've rolled it out in our pilot test with our local health departments, those 9 or 10 local communities who were the brave ones who raised their hands to said, we'll be the first to work through all the glitches. And they're finding them, which is good. That's what a pilot test is for, and that's why we're doing this pilot testing week. Some of the things that they have found are that the way second doses were scheduled was not going to be feasible. This is, as we've said before, really complicated, and you got to make sure people who got a Moderna dose the first time get a Moderna dose the second time. And because of the way we distribute vaccine, we have to make sure people come back to the same site for their second doses. So we've been working with Microsoft and are releasing a new portion on the second dose scheduling that is going to go live tomorrow. We're working with those local health departments. We've also been working with them. They were concerned they had people on waiting lists, and if we just suddenly opened this up to the whole public, that the people on the waiting list, like that gentleman we were talking about before who was worried about getting his vaccine, if he was on a waiting list, we don't want him crowded out. And so we've been working with Microsoft on a way to import those waiting lists and get folks who have been waiting into the scheduling system so they can move forward. I'm sure there's a number of other smaller things, but I have to give a big call out to the DHS IT team who's been working on this with Microsoft. Microsoft has also been very responsive in connecting us with other states that have been using their products successfully, like Tennessee, Oklahoma, Nebraska. And so we've been learning from their experiences as well. And we feel we will be on target to open the site later this week. And so pilot testing going well. A reminder that this will be primarily focused on local health departments in the beginning. Other vaccinators may come on through the month of March. And so we will slowly build vaccinators into the system. And just a reminder that other vaccinators, like most health systems, some pharmacies will continue to use their own system, but that's where the map I talked about earlier will become helpful to people, so they'll be able to find, if I'm going to a certain health system, here's their registration link or their telephone number, and we can get to them directly.
Thank you, Chuck. Now to Tom Dorian from TMJ4 in Milwaukee. Tom.
Yeah, good afternoon. Most of my questions have been asked, so I'll ask this kind of 30,000-foot question. The numbers are pretty low right now with the positive cases, lowest we've been since back in the summer. And I just wonder what we attribute that to, because testing is also down, or do we see this as it is spreading less in our community? Thank you.
Dr. Westergaard, you want to take that question?
I'd be happy to, thanks. I think the first qualification is that statewide disease activity level is lower, but it's still high by the standards that we've defined back at the beginning of the epidemic and before the summer. So we've defined, as many states have, low disease activity level at a specific threshold of 10 cases per 100,000 population over 2 weeks. Right now, statewide, we're still 200 cases per 100,000 population for 2 weeks, so 20 times higher than what we would consider low disease activity level. So that's important to keep in mind, because it's definitely true that we're in a much better position than we were at the beginning of winter. We're still not where we want to be, and the virus is continuing to circulate in communities at a level that is too high. And so that's why it's very important that we don't stop the community mitigation and the containment strategies and all the tools that we've developed, and we continue to march forward with our mass vaccination campaign. Those are really the two pieces, the two benchmarks when we talk about life getting back to normal. We need to have low disease activity level, essentially zero disease activity level, but that may or may not be feasible given the widespread extent of the epidemic in the globe, worldwide, and the likelihood that people are going to travel. So we want it to, at least to be sustained transmission at a very low level and very high levels of vaccine-induced immunity. That's going to protect vulnerable people from severe illness and death and prevent hospitals and all the things that we experienced and were very worried about in the first year of the epidemic. We can prevent those by continuing to implement the tools that we have. So as for why the disease activity level is lower than it was, I think it's successful implementation of all the things that we've talked about. I think a little vaccine-derived immunity, and infection-derived immunity, meaning people being protected from a subsequent infection after recovering, have both played a role. But I think an even bigger role has been successful adherence to the strategies of avoiding gatherings, wearing masks in public, getting testing, doing contact tracing, doing quarantine and isolation. I think it's an ongoing success story that we are in a better place. But I think the main lesson is that we're not where we want to be. We need to continue to work very hard to try to prevent new cases and drive the epidemic to very, very low levels.
Thank you, Tom. Now to Daphne Chen from the Milwaukee Journal-Sentinel. Daphne.
Hi, thank you so much. I had a question about the family care and IRIS programs. Thinking about frail people with disabilities in their own homes and apartments are going to be a lot harder to find than, say, teachers. So just curious what DHS is doing to ensure that people in these programs are not lost in the shuffle. And I was also curious when SPMAC might come out of hiatus to finalize Phase 1C. Thanks.
So in terms of family care and IRIS, the good news is that those programs are administered by our Division of Medicaid Services, and they work very closely with managed care organizations who provide the care to all of those folks that you've mentioned. And so we will be working very closely with our managed care organizations to ask them to be accountable for identifying members under family care and IRIS who have not yet been vaccinated. Some of them already have, because they are, many of those members are over age 65, but particularly those that are under age 65 who may have disabilities and other conditions that would put them at risk. We'll be working with the managed care organizations. And we're working on getting through this beginning of phase 1B, and then we'll be working on considering who will be in 1C, clearly looking at recommendations from the Advisory Committee on Immunization Practice. We know they are meeting today and tomorrow. I don't know that they'll have any further recommendations about phasing, and we know they'll meet again after the FDA makes a decision about J&J, and so we are anticipating they may have further recommendations around phasing in any of those discussions.
Thank you, Daphne. Now to Mary Pouch from WQOW-TV in Eau Claire. Mary.
Hi, thanks for taking my question. As regards to, we've heard a lot of people, for lack of a better term, jumping between vaccinators, between their doses. Say you get your first vaccine at Prevea, your second one with your local health department. And we've heard conflicting advice on this, saying you should do this so you can get your second vaccine as soon as possible. Others say you should stay with that first vaccinator because they set that second dose aside. So what is the DHS's advice on that, and what do they suggest people do in those situations?
Absolutely. If you can, stay with the same provider for your first and second dose. There's two main reasons for that. One is that provider is probably tracking when your next dose is due, will be reaching out to you for an appointment, or maybe has already made an appointment for you when you received your first dose. And we send 1,000 doses to Prevea this week, and if it's Pfizer vaccine, 3 weeks later, we send 1,000 doses to them for the second doses. So that's the second reason, is that we are sending your second dose to whoever gave you your first dose. The other reason I'd say it's really important is we want you to get the same brand of vaccine for both of your doses. The recommendations are, if you get Pfizer for your first dose, you need Pfizer 21 days later for your second dose, and staying with the same provider will help with the scheduling on that. If it's Moderna, it's 28 days apart. There is some leeway in those second doses, but you really want to strive to get the same manufacturer for both your first and second dose, and staying with the same provider is also going to enhance that.
Thank you, Mary. Now to Gabby Bachara from News 3 Now in Madison. Gabby.
Hi, thanks for taking my question. I was just wondering if you guys know about how many educators and child care professionals need to be vaccinated, if you have a number, and how long you're expecting that process to take before you can move on to the next people in the group who aren't prioritized.
So we have some gross estimates. When you look at child care providers, staff in public and private schools, and also the higher ed faculty that are in direct student contact that are included, we're estimating this group is somewhere around 225,000 plus or minus a little bit. But that's our best estimate.
Thank you, Gabby. Now to Ben Farrell from the Daily Cardinal from the UW-Madison. Ben?
Hello. Hello, this is Ben Farrell with the Daily Cardinal. I just wanted to ask if any discussion had been made about the new London variant of the COVID-19 virus appearing in Madison, or if that had changed plans for mitigation or lockdown purposes on your guys' end. Thanks.
Dr. Westergaard, would you like to respond to that?
Sure. So, can you hear me now? We can hear you. So, to date, we've detected 6 specimens of SARS-CoV-2, the virus that causes COVID-19, that fit that same genetic pattern that was described in the United Kingdom as the B117 variant of concern. So that's, as we've discussed, the reason that that's important is because that specific variant can be more highly transmissible, so it can spread faster in the community. So last week, the first such case was detected in Dane County. But there's an important distinction between detecting something in the lab and having an accurate understanding of how widespread it is in the community. In Wisconsin, like most states, we test a very small number of the positive tests. The specimen that gets collected from the person, from the patient, gets first a diagnostic test to find out whether the virus is present. And then a subsequent step in a more specialized laboratory needs to be done called whole genome sequencing to know whether it is one of the variants of concern. So we do that currently for a very small proportion. The fact that we found this variant in multiple counties among people who have not had international travel, and the fact that other states around the country have found the same thing at an even larger scale, gives us pretty reasonable amount of certainty that this is spreading in the community from person to person, and we should use that as an indicator that we need to step up our efforts. It doesn't change our strategy per se. All of the strategies about preventing person-to-person transmission and the importance of vaccination still apply. I would say the reason people should pay attention to the news about novel variants are really the threat that they can represent, that new viruses might emerge that can spread more rapidly, more easily person to person. What it calls for is more intensive application of the tools that we have. But at the end of the day, they are the same virus, the same vaccines will work, the same strategies will prevent transmission. We just need to do them much more intensively.
Thank you, Ben. Now to Bram Sable-Smith from Wisconsin Watch. Bram.
Hey, thanks for taking my call. My question is kind of in that spirit of the shot in the arm is another person vaccinated. So I'm wondering, what guidance is the state giving to vaccine providers for how to use leftover or expiring vaccines that might otherwise get thrown out? Like, are you asking them to keep a list of people nearby who could show up quickly for a shot, or pull people in off the street, or find other nearby venues that could use the vaccine? What's the plan there for preventing throwing vaccine doses away?
So those are all really great strategies, and I know our vaccinators across the state are using all of those. Our counsel to them is, first of all, to plan carefully, to only thaw or bring out the amount of vaccine that you anticipate you're going to use in a given day in a given clinic. But we all know situations happen, snowstorms happen, they're able to get an extra dose out of the vial, people don't show up for an appointment. So we know there are days they're going to have to make those decisions about how to use a vaccine at the end of the day. So many organizations are keeping a list of people who could get there quickly. Many are reaching out to other providers in their community or other entities and saying, for example, schools, and calling the school and saying, hey, we know you're next in line and we've got 5 extra doses today. Do you have 5 teachers or 5 staff members who want to come over and get the vaccine? So all of those strategies are being used. We at DHS are not requiring our vaccinators to use any one or the other strategy because we know it just plays out differently in different communities in the state. We've had relatively low wastage of vaccine in the state, and it's primarily been when they can't get the prescribed number of vaccines out of a vial. And so our vaccinators are finding ways to do this.
Thank you, Bram. Now to Ryan Urban from the Barron News Shield. Ryan.
Hi, I was wondering if you could tell us more about the split between the Douglas and Barron County sites, and why not just have 2 full-time vaccination clinics at those sites? Thank you.
So our sites are based on anticipating being able to do about 1,000 doses a day. And so it requires a certain population in order to be able to do that volume a day. And so there are parts of the state like Douglas and Barron County where there just aren't as many people to sustain that kind of site over a long period of time. Yet we certainly don't want to leave that part of our state bare with no vaccine resource. So the logical approach that we chose was to put one team there and have them spend a certain portion of the week in one site and a certain portion of the week in the other site. So we think we'll actually get through all the people who will want vaccine when we get to open vaccine as quickly in a site like this based on the population ratios. In other parts of the state, we also can mobilize our mobile vaccination teams. Those are an excellent option, again, for smaller communities that want a boost. We can send a mobile vaccination team, just like we've sent our National Guard community testing teams to communities, and they can enhance the efforts of local vaccinators in other rural counties throughout the state. So it's a variety of approaches to best meet the needs of residents throughout Wisconsin.
Thank you, Ryan. Now to Amy DuPont from WKBT-TV in La Crosse. Amy.
Good afternoon, thank you. Here in the city of La Crosse and La Crosse County, our private hospitals have had to cancel hundreds of appointments to administer the COVID-19 vaccine. When the vaccination site, the state-run site, opens here in La Crosse County somewhere, how will that affect the number of doses that are allocated to our private hospitals?
Yep, we're still going to be giving vaccine to the private hospitals, and we're getting better and better at helping all of our vaccinators, including the hospitals, see a week or two ahead of time how many appointments they're going to have based on how much vaccine they're going to have. In the beginning, we only found out a week ahead of time how much vaccine we'd have. We're now finding out 2 to 3 weeks ahead of time. We're conducting our survey and getting information to them now a week or two ahead of time, and that should help them be able to estimate how many appointments to make based on how much vaccine they will be getting. All of this is predicated on we're going to be getting more vaccine. And so we'll have more vaccine for the community vaccination sites, more vaccine for the healthcare providers, and more vaccine in arms across our state. We just can't sit and wait and think we're always going to be like we are right now. I mean, we're very different than we were a month ago. So all of this planning is looking ahead, knowing that the vaccine supply is anticipated to increase over the next few weeks and months, and we want to be ready.
Thank you, Amy. And our final question this afternoon belongs to Scott Bauer from the Associated Press. Scott?
Hey, thanks, everybody. Julie, going back to the FEMA sites, is it a done deal that there will not be additional vaccine from the feds for those sites, or is that just the current thinking? I know there had been some hope that maybe that they may change course and end up providing vaccine.
Well, I'm not going to call it a done deal yet. We keep asking, and we keep hoping that they will. And I think, Scott, it's related to the vaccine manufacturing production. And so FEMA has said they're going to continue to evaluate how much vaccine is available and where they should put it. And so even if we start with state allotment, I'm not convinced that at some point in the future there might not be a federal allotment if we start to see vaccine flowing at greater rates. So it is the current planning assumption is that we have to use state allotment, but I think we're all going to focus on continuing to see if there can be a federal allotment moving forward.
Thank you, Scott. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.